Understanding Commercial Sex Policy, a Global and U.S. Perspective. This presentation is brought to you by Ivania Grenier, Bianca Fields, Jesse George, Jessica Jones, Kendra Lamb, Elizabeth Ortega, Humberto Ortiz, and Kelly Ulloa. Commercial sex, also known as sex work and prostitution, is the engagement of workers in sexual activity with clients for money or other negotiated goods. While the revenues are high, sex workers have to share their profit with their managers. The public health issue at stake here is the health of these workers and their clients. It is estimated that the disadvantage of commercial sex significantly affect healthcare costs expressed in combating such diseases as HIV/AIDS, syphilis, gonorrhea, and other contagious diseases. Many women that engage in this activity have poor access to healthcare services or ignore the necessity to check their health at all. Unfortunately, the rates of STIs are 5 to 60 times higher among sex workers than in general populations, and these individuals are often unaware of their infection status. This further endangers their own health risks and increases the risk of infecting others. Surveys of female sex workers show that 35 to 55% have engaged in unprotected commercial sex, with 10 to 35% report never using condoms at all. Female prostitutes can average 17 sex partners per week. Only 47% of these women are even aware of their HIV status, and less than half have had a health screening in the previous year. It should be emphasized that the US and global contexts are different with regard to commercial sex. In terms of annual profits, the US accounts for $14.6 billion of the global $186 billion industry. Globally, many sex workers are victims of sex trafficking through force and violence and have access to little or no health care. In the US, sex workers have opportunity for more access to quality care compared to those who are victims of sex trades, especially Africans and Middle East immigrants. Because sex trafficking and sexual exploitation, including prostitution, is mostly an illegal industry in the US, it is not possible to construct a representative sample of those trafficked or otherwise involved. Therefore, traditional research methods are not available to answer the prevalence question. Most of the often cited statistics about trafficking prevalence are estimates from advocacy groups and social providers. Many research projects analyze arrest data to ascertain information about the number of those involved in the sex trade, including buyers, pimps, traffickers, and exploited and trafficked people. Sex trafficking is defined as someone using force, fraud, or coercion to cause a commercial sex act with an adult or causes a minor to commit a commercial sex act. Whereas commercial sex includes prostitution, pornography, and any sexual performance done in exchange for any item of value such as money, drugs, shelter, food, or clothes. Healthcare providers are on the front line for identifying victims of commercial sexual exploitation and sex trafficking. Despite the potential opportunities for intervention, healthcare professionals often overlook or fail to identify victimized individuals. According to the Family Violence Fund, at least 28% of victims have seen a healthcare provider at least once during their victimization. In another study reported, 6 out of 12 victims interviewed reported seeing a healthcare provider for treatment of sexually transmitted infections, testing for pregnancy, and/or abortion services. Lack of adequate training was identified as the key barrier in identifying sex trafficking victims. Other barriers include lack of understanding of commercial sexual exploitation and sex trafficking, lack of policies and protocols for these crimes, and lack of disclosure by victims. In all 50 states and the District of Columbia, healthcare providers are mandated reporters of suspected child abuse. In some states, reporting is only required if the abuser is a family member or caregiver. This leads to most commercial sex exploitation and sex trafficking of minors not falling under the mandatory reporting requirements. For this reason, several states, including Florida, Georgia, and Massachusetts, have passed legislation that includes commercial sex exploitation and sex trafficking of minors by non-family members as reportable forms of child abuse. Trafficking Victims Act is the landmark legislation that catalyzed the modern-day fight against human trafficking. Human trafficking, also known as trafficking in persons, is a modern-day form of slavery. It is a crime under federal and international law. It is also a crime in every state in the United States. Under U.S. federal law, severe forms of trafficking in persons includes both sex trafficking and labor trafficking. Over 31,000 potential human trafficking cases have been reported by the public to the National Human Trafficking Resource Center hotline between December 2007 and December 2016. The vast majority of these cases involve trafficking for sexual exploitation. The National Human Trafficking Hotline maintains one of the most extensive data sets on the issue of human trafficking in the United States. As stated, trafficking for sexual exploitation is of higher incidence, with 6,081 cases reported in 2017 versus 1,249 for labor trafficking. Common venues used for sex trafficking include massage and spa parlors, hotel or motel-based venues, and online ad solicitations. Females make up the large majority of trafficked individuals. Again, these figures are only estimations and do not define the totality of human trafficking, as most incidents go unreported. There is a reported high rate of commercial sex use amongst the Hispanic migrant population, with 30% of Northern California Mexican farm workers and 18% of migrant farm workers on the East Coast admitting to contact with commercial sex workers. 44% of 342 surveyed male migrants who returned to Mexico admitted to commercial sex use while in the United States. In one particular study of Hispanic migrants working in North Carolina, it was found that those who used commercial sex workers had a higher incidence of HIV, and 28% reported being very concerned about becoming infected with HIV. 92% report always using condoms with commercial sex workers. However, once they were familiar with the worker, the use of condoms decreased, thus increasing the STI risk. A bill called Reducing Criminalization to Improve Community Health and Safety Amendment Act of 2017 was proposed at the Senate level by David Grosso and Robert C. White Jr. regarding Washington, D.C. As in Nevada, it is expected to decriminalize commercial sex and protect the rights of women. For example, this bill proposes that if a sex worker were to be attacked, she should not be afraid to seek health services, as there would be no threat of being arrested or charged with prostitution. While it is currently under consideration of the state Senate, the outcome of the legislation is not clear. In conclusion, commercial sex is the industry in which primarily women sell sex services and men purchase them. This makes the first group vulnerable due to the current criminalization laws. The example of Nevada and Nordic countries show that legalization and decriminalization seem to be more effective compared to the current U.S. regulation. There is a need to protect sex workers from violence and give them access to health services, while their clients should be also viewed without stigma.